All right, so we're live. We are live. And we are live. All right, so good afternoon, everyone. I'm Dr. Pierre here, favorite board certified internist, founder of drbarrypierre.com, host of Lunch and Learn with Dr. Barry, and of course, your host of the Empower Yourself for Better Health series. This is episode 66. And of course, if this is your first time going around, we are actually broadcasting live on 3 of my channels that I'm on from a social media standpoint. We are on, and you'll see me kind of look side to side, right? So right now, the camera I'm looking at right now is my YouTube channel. We have Instagram on the right. We have Facebook on the left. So we're going to be talking to as much people as we can during the short time I got you guys for this series episode. And again, if you have not caught on before, I usually do these episodes. I try to do this once every couple of weeks. We're definitely going to start bringing this a little bit more consistently, maybe even once a week, depending on how the scheduling goes. I used to do this more as an outpatient doctor, but that's because my schedule is a little bit more defined. Like I always knew I had this block of time where I wasn't seeing patients. On the inpatient side, it's a little bit more difficult because things happen, especially if you've been in a working hospital. You already know things happen at quite a different time. So, but we do want to make it a point that we'll bring this a little bit more consistently for you guys. So, that being said, again, this is episode 66. The title is essentially, why your doctor, right, has to be the most confident person in the room, and I think it's big, right, for a lot of different reasons. Because if you have not caught on, July is Minority Mental Health Awareness Month. And when we always talk about mental health awareness, I'm big on that. I talk about the onus of being, kind of true to yourself, right? Like kind of mentally fit to do this thing, which is, saving lives every single day, right? Which is essentially what we do on a day-to-day basis, right? So as physicians, especially in a hospital setting, but most physicians, in fact, I don't know any physician that doesn't require saving some type of life in one way, shape, or the other. So, this is a job that, is not for the weak. And, I appreciate all of my physicians out there who, get up every day and get to work. And so that's why I wanted to kind of touch on this topic this week, because this is, first Friday in July where, we really get to hit home Minority Mental Health Awareness Month and just mental health in general. And I thought, what better way to do it than really talk about the issue of confidence. And if you've been on social media, you've probably seen a lot of the memes that were dropping the past couple of days, right? Where, they're telling people to, avoid the ER because interns are in the hospital, right? Which, as a program director, is kind of funny to me because every time I see something like that, my first question is always, well, where's their seniors at, right? Where's their attendings at, right? I think we do this big to do that, interns are in the hospital in July. As if everyone else just kind of leaves, right? Which isn't the case, right? Even though you have interns, there's always seniors, there's always attendings, or it should be, right? And we've already kind of like debunked that myth that people who come to the hospital in July, have bad outcomes, right? That's already been like kind of washed away. In fact, I would always argue that the outcomes are probably better, right? Because we know we got interns in there and we try. I'd actually be more worried about like June, right? And, like May and June, like towards that tail of the end year where, we kind of like, slack off on the interns a little bit, right? Like I'd actually be more worried about those 2 months than I would about July. Because July, we're really like, let's make sure we watch every single order that this intern is doing, or every single test or every single procedure. So, that's that, right? From that standpoint there. I think when we talk about, self-confidence and we talk about the importance of it, I think first and foremost, we have to ask why, right? Like, why does, Dr. Barry feel that your doctor should be the most confident person in the world, right? And most importantly, because this is a life or death thing, right? Most of the time, again, as a hospital physician, I take care of patients who are acutely ill, at their most worst state when they walk into the ER. And my goal is always to get them out, right? Again, if I've talked about this before, my goal anytime you come into the hospital is to get you outside of the hospital, right? So you can like walk out the doors because it's not guaranteed. And I tell you, I've taken care of patients who come in for headaches, dizziness, abdominal pain, chest pain, leg swelling, constipation. I've taken care of a wide variety of patients who come in with very simple complaints who don't leave the hospital, right? So I'm always thankful when I do get the chance to see someone actually lead, right? It's something that I definitely always look forward to. So that's why, I stress this importance, right, of, being confident within your skills, being confident in what you do, how you do it, because it's going to be tested over and over and over again. Like I said, I've probably taken care of probably thousands of patients, right, who came in with chest pain, right? But I treat every chest pain patient like it's a new one, right? Because you don't want to, miss anything, right? Because again, like I said, this is someone's mom, dad, uncle, brother, sister, grandfather, grandma. This is someone's family member who is counting on you, the physician, right, to be able to know what you're doing and know what you need to do to get this person like out the hospital. And I think that's something that as time gone on, again, I am 3 years out of residency. Let me see. Oh, no, not even three. Five. Take it back. I'm 5 years out of residency. So I finished residency in 2014. And so I've got a little bit of experience in my belt, right? But I work with people who've been out of residency for 10, 15, 20 years, right? So, just to give you an idea of the level of experience that you need. But I can't walk into my patient's room being like, oh, well, I just got out of residency a few years ago, right? No, like I got to be able to stand out and say, no, this is what we're going to do, and this is how we're going to do it, right? Because you'll be surprised, right? Most of the time, your patients are scared, your family members are scared. So when you get these questions, concerns, especially I want to talk to the residents and my medical people who are following me. When you get a lot of these questions or concerns, right? It's usually bred out of fear. It's that fear of the unknown, right? It's that fear of like, I don't know what's going on with my mom. I don't know what's going on with dad. But I need you to somehow try to clarify, what's happening, right? So I can be at least a little bit reassured. I can tell you a lot of times it doesn't even matter, right? A lot of times you could do all that you're supposed to do, right? You can, give them the step-by-step process. You can let them know, like, this is how the hospital process is going to go. This is how the hospital stay is going to go. And it still doesn't matter, right? You're still not going to be assured. But could you imagine, right, if your family member was in the hospital bed or in the office or somewhere, right, and you're taking care of them, and you're asking that doctor questions, right, and that doctor seems kind of shaky, right? And I'm not telling physicians that they should know everything, because that's definitely not the case. They should be able to know what they know and when they don't know something. And I think that's what really kind of sways some of my residents, right? Again, I'm program director. I got 18 residents walking around the hospital, and it's very evident, right, when my residents don't know something. And I don't really, take it back. We get on them a little bit when they don't know something, right? But the most important thing is I want you to understand, like, I'm not expecting you to know every single thing, right? Like, that's just not going to happen. It's never going to happen. Again, I'm 5 years out, and I still don't know everything that I should, right? Again, new articles are coming out every single day. Every single day, a new article is coming out. Every single day, a new test is coming out. Every single day, a new way of treating something I've been treating 10,000 times before comes out, right? And I always have to be up to date with that, right? But I also need to be able to communicate with my family, with the family members and the patient, that like, hey, like I'm not sure. I may not know what I'm doing like right now 100% fully, but I'm going to make sure the people who are around you are going to be able to take care of you, right? So that's why I always stress this level of confidence in and of itself, right? Because I've seen the result of a person who isn't confident, right? Especially as a physician, right? I've seen physicians who are not as confident as they should, right? Those are physicians who tend to order more tests, tend to, get more consultants, tend to do a lot of things that isn't in the best interest for the patient, but it's in the best interest for themselves, right? From a protection standpoint, because everyone's afraid of something. So they're constantly consulting or constantly pushing off and just saying like, no, this someone else got to do it. Again, I get phone calls from the ER all the time of patients who don't know, of physicians who are like, hey, I'm not sure what's going on with this person right now, but like, I'm going to kind of pass it off to you, right? And I don't want you to be the person that passes it off, right? Like, I want you to be able to say, when you walk into a room, right, you say like, hey, I'm Dr. Pierre. I'm going to be a physician there at this hospital course. This is what's happening. Yeah, that's what Kyle says based on neurologists in the hospital. Yeah, yes. So yeah, we do have some specialties, right? One of my Facebook comments essentially talked about how a neurologist at his state like do this all the time. I got some specialties that every chance they get, right, they're pushing it off, right? Every chance they get, they're ordering another test and doing stuff that, again, this isn't in the best interest for the patient, and that's a it's a terrible way of being, especially if you're a physician, right? It's just, again, I have to sometimes, I want to strangle my residents sometimes, right, when they do some things like that. And I always ask them, like, why'd you do that for? And a lot of times, well, I didn't know. I just wanted to see what the result got. And one of my mentors, Dr. Kenner, he stressed, right, like before you order any lab work, any imaging test, that you should know like why you're ordering it, right? Like if you don't know, or if you're not expecting a certain result from a test, you shouldn't be ordering it, right? There isn't no, I'm just going to order the test just to order it. Especially in this day and age where in medicine, especially in the residency world, we are really focusing on the financial aspect of it. I think beforehand we did it, right? You know, we'd order $1 million workup test, but when we talk about $1 million workup, the person who's paying that $1 million isn't us, it's the patient, right? And so now patients are being more aware. The insurance companies are definitely being more aware. So even the hospitals are being more aware. So everyone wants to make sure that you're not just like running up a bill because you don't know what you're doing, right? Because not only do you have to be the smartest physician, you also have to be the most cost efficient physician, right? We don't want that, right? We don't want you spending all the kind of money just to spend it, right? Like that's just not going to happen, especially in this day and age where everyone's counting pennies. And again, and obviously I'm in a hospital setting, right? So I definitely have, a skewed approach to what we do, right? But when I was doing in outpatient medicine, I think it was just as worse, right? Because on an outpatient side, you couldn't just do tests just to do it, right? Like a lot of times, let's say I order a certain imaging test, right? If I didn't prove to the insurance company in my documentation, in my in the way I did things, like the insurance wasn't covering it, right? Like, so there's just certain things that you just couldn't do just to do anymore, right? Oh yeah, perfect. So you also have a consult. Think about having this coming for a consult. So, yeah. So you definitely want to know, why you want to get someone, right? Like again, I'm a hospitalist, right? And where I trained at, especially with a lot of my attendings, they didn't like us getting consults. One, probably financial, right? But two, right, because they wanted us to make sure we knew what we were talking about when we had to call a consult, right? Especially because a lot of times when I would get a consult, I would have to be on the phone personally to say like, hey, I need you to do this, this, and that, right? And if the consult person I would call like felt like I didn't know what the hell I was talking about, right? He was definitely going to let me have it. He or she was definitely going to let me have it over that phone, right? So you best believe before we even made those steps, right, before we made that leap and say like I need to get someone to come help me, you best believe I knew why I needed someone to come help me. And again, like I said, this is July, right? Interns are everywhere across the country, right? And so you're gonna have a lot of people who don't really know a lot, which is okay, right? Because again, you should have seniors, you should have people backing up, you should have people there who's willing, right, to help, right? So that shouldn't be the problem. But as a message to my interns everywhere, right? Like I want you, right, to be able to say like, all right, yes, I know a little bit about what's going on, but I don't know enough, but I know my seniors got me, right? And then especially to my senior residents, right, to my PGY2, my PGY3s, and again, they know a little bit more than the interns, but they know they're not ready there yet, right? Again, you always should know you should have some type of backup in tow, because again, I talk to family members all the time, right? And because I talk to family members all the time, I hear the gripes, I hear the concerns, and the last thing a family member wants to have to deal with is someone who isn't confident in what they're doing, right? Because remember, right? And even if you're not confident, right? If you can't even like act like you're confident, because again, the family members can smell all the way, right? Like if they feel like, you know what? I may not know a lot of medical terminology, right? But this person, the way he talking to me, I don't feel like he knows it that much either, right? Like that's going to be a problem, right? We don't want that, kind of moving forward. And again, that's something we will stress, to our residents and especially to our interns, to the end. So before we get out of here, because it's been a few minutes, right? Before we get out here, I want to kind of preface it to, just self-reflection, right? And I think that's really where it all boils down to, right? Like people who are confident are 100% aware of what they can do and what they cannot do, right? So if you're the type of person, right, and again, this doesn't just have to apply to medical professionals, right? This is just life in general, right? If you're the type of person who, has trouble recognizing what you're good and what you're good at, right? Your confidence is always going to be issue at hand, right? Like confidence will always be a problem that you're going to have to deal with because you're just not fully there and invested yet. And that's a concern, that will not only affect what you do on day to day at work, but it'll affect your relationships. It'll affect your personal self and mental well-being, right? When you don't know what you're good and not good at, right? So I wanted to kind of start this month series of just kind of self-reflection, self-confidence, because throughout the whole month, right, especially if you're one of my podcast listeners or the blog writers, right, we are going to have some amazing guests kind of talk about just that journey of recognizing, what we do good, what we don't do good. You're going to have people talk about self-confidence. You're going to have people talk about like how should we value ourselves, right? So you're going to get a wide range of discussion over this month of July. Again, it is Minority Mental Health Awareness Month, but honestly, it should be Mental Health Awareness Month every single day, right? Like every single day, you should make sure your mental, fortitude is right then and there. Because again, maybe you're not like me, right? Like maybe you're not in a job where you're saving lives every single day, right? Like, I'm like a modern day hero, right? Maybe you're not that, right? But that's okay, right? But whatever you do, right, you got to make sure you're going to it 100%. So if you're working at McDonald's, if you're working at Chick-fil-A, right, you're working at the school board, wherever you work at, right, from a wide range, like I need you to go in there thinking like I am the best person for this job. And there's no way they can replace me, right? Like that's, if you don't get anything else from today's talk, right? I want you to go into your job thinking like, I am the best person for my job. I'm the best person. I'm the best worker in this building, right? And there's no way they can replace me, right? Because like if you're not even walking in with that level of confidence, right, you're already lost, right? Again, every time I walk into Wellington, every time I walk into this hospital, I walk into the thought process that I'm the best doctor here, right? I just gotta do it. Even if there's some data out there, some crazy data out there that says I'm not, right? I ain't gonna believe it anyways. If there's some data that says I'm not the best doctor, I'm not gonna believe it. But the second I step foot on this campus, you best believe that's what I go into, the feeling like I'm the best physician here, and I'm gonna save a million different lives because I'm here. And that's what I want everyone to do, right? I want everyone to not only take the self-confidence of what a physician should have, why a physician should be the most confident person in the room. I want you to walk into your jobs. I want you to walk into your relationships, right? Walk into your family, your friends. I want you to walk in understanding like, no, I'm the top dog here. I'm the best person here, and walk in with that level of confidence, and I will just kind of exude out. So that is episode 66 again. I appreciate everyone who joined on, whether you joined on from Instagram, Facebook, YouTube, wherever you joined in from. I appreciate you. You guys have a great and blessed day. Like I said, we are going to make it a point to do this once a week, just so you guys are consistent. And like I said, we'll try to do it Fridays because I like Fridays, and Fridays between 12 to 1-ish. That may change just depending on if my day job schedules a meeting, right, from 12 to 1, because that sometimes happens. And if not, it'll be like 1:30 in that regard. So thank you. Shout out to Saint. So my fraternity brother Saints here. So again, you guys have a great, blessed day. I'm be out of here. Like I said, I got a few more hours before I can cut out early. And this week, fortunately, I don't have to work this weekend. But this is my 12th day in a row. So I had to work last week. So I'm definitely got zero plans to do nothing. Which is always good, right? Because when you're like low key washed, that's always a good thing. Y'all have a blessed day, and I'm see y'all next week. Bye.